Hey guys, Jasmine of IPS. Today we're talking about what is the healthcare revenue cycle. We're going to split this video up into a few different parts so that we can take a deep dive into each specific element. Next piece, after a claim has been paid, so in between denial management and patient billing there's possibly two things. So after you've worked on your denials, in denial management and AR are things like appeals. If the insurance company denied something for medical necessity or they requested some additional information, you're going to find that the insurance company is going to get a little slower in that appeals process. So we talked about the days in aging being about 14 days. When we talk about appeals, it usually is a timeline. Very frequently, their favorite quote is something like 20 to 30 business days. And some of the insurance companies may say, allow us up to 60 business days to process an appeal. You know, they will have their specific time frame that will kind of be a clear indication of when you need to pursue that claim again. However, the ultimate goal is payment, right? And if you cannot get that paid, an insurance company is still denying that claim, and it's something that you can bill to patients. If it is something that you can bill to patient, then the next piece, or after the insurance company has already paid their maximum, and maybe we didn't quite collect on the money on the dime for a deductible, then what's left on that patient's account gets sent to the patient in our patient billing element of the revenue cycle. So we generally are submitting patient statements. Most frequently, they're done on paper still. There are some really fantastic systems out there that allow you to e-transmit. You have to obviously have the proper paperwork to do this, but once your patient has authorized you to e-transmit their balances via text or email, then these systems have become so intelligent that you actually can even transmit a link for them to pay right from their smartphones or from their computers. So if you're looking into some technology like that, that's always a nice plus to have an ease of use for patients to get their money to you. People discount the amount of time and money lost when they don't have an easy process for payment. If a patient has to call you during business hours and you take a 2-hour or more lunch break and the patients are working a 9-to-5 job, you are losing a tremendous amount of revenue in that process. So I would 100% recommend that you either outsource that element of your business to an outside agency like we process payments here at IPS, or, as I said, use a technology, something that's online. Perhaps your statement company utilizes a really great system that can process patient payments as well. So there are a lot of statement companies or statement processing systems right now that allow for online payments. So it can be a little bit costly, but if you weigh the cost benefits of the number of accounts that you have going to collections versus the amount that's actually being paid by patients there online on that website, I guarantee you're going to see a benefit to that. You see a lot of hospitals utilizing tools like that for that reason, because it really can help to minimize the number of accounts going to collections. That takes us to the next part, collections process. So once a patient's been billed, whatever your cycle is, and again, another video will talk about what that aging cycle looks like for patient billing. It can look very different from organization to organization or patient or practice to practice. You're going to find that it's gotten shorter. It's a good thing, which means that basically patients get less opportunities, less of an opportunity or time to just take action, right? A lot of our practices or organizations in this day and age, they aren't penalizing patients if they are reaching out and trying to make payment arrangements or things like that. What happens, what we find is the practices that are playing this game the right way, the long game of keeping a patient, they are only pursuing patients in collections if they are not taking any action, not hearing from them at all. The patients just are completely ignoring the communications. If you sent them maybe 2 statements or 3 statements max, perhaps had a collection call done by your agency as well, then I would suggest that you move that claim, that patient's balance along to collections process, because you're going to lose a lot more money continuing to try to collect on it. Obviously, we do recommend a threshold for that. A lot of practices have different numbers. Some don't have a minimum for their moving into the collection process, but it is kind of it's kind of silly to send someone to collections for a $15 or $20 balance. But, you know, again, it kind of goes back to retention, right? If you get an opportunity to have a patient return to your office and you send them to collections for $10, it's highly unlikely that they're going to want to come back to your office. And, you know, perhaps they've moved, perhaps they never got your letters or your communication, and they just, you know, were out of the country for a year or something. There's a chance that once they find out that you sent them to collection for $10, that they will never return to your office. So I say that with also kind of it keeping in mind that I recommend 100% that you really consider the companies that you're using to pursue your patient balances. We find a lot that these practices are sending out patient statements and hoping and praying that the patients are going to pay. They don't have another way to communicate with the patients via like a robocall, just letting them know that they have to reach out to the office regarding a business matter, or sending out a text message asking them to reach out to the office. There's all kinds of ways using new technology that, again, if you have the right authorization paperwork in place with your patient, that you can communicate with those patients more effectively and less costly. A lot of these statement companies, or statement clearinghouses, we call them as well, those statement clearinghouses will transmit patients' text messages and even perform the robocalls to the patients at a fraction of the cost of for paper statement. So if you can have a phone call going out to those patients in addition to that statement, I guarantee you will see a reduction in your patient billing, and you will see an increase in that patient payment, so that you, again, will see a decrease in the collections. So really consider that patient billing process. Really think through who you're using in this process, because what you'll find is a lot of these companies have done a great job at trying to really improve that process and make it so that the goal ultimately is to retain the patient, you know, obviously get the bill paid and retain the patient. So once you get to the collections piece, it stops the cycle in most cases, right? So we call this a cycle, and it can be very cyclical, especially if you have a practice that is maybe like a family medicine practice, or a therapy facility, or a mental health facility, where patients really need to come back in for care. The moment that you have to send that patient to collections, you are stopping that revenue cycle, which obviously can impact your growth as a practice or an organization.